Thank you so much. My name is Gary Gravesandy. I am a product manager at the Mount Sinai Health System, as well as a medical student, hoping that the healthcare system I enter is a little bit more accessible and efficient than the one we had today. Joining me today are two excessively experienced individuals, and we're looking to share all of our insights with you around what it takes to sell to a health system. As we go through our webinar today, we're going to have this structured interview at the beginning. And as we go through some of these questions, feel free to add any questions you have as well to the Q&A section of the Zoom. Well, we'll monitor the chat on the side. Most of the questions we'll be answering over the course of this webinar will be from the Q&A section. There have also been some questions submitted via email to this group. We'll go through those first at the end. So feel no need to repeat sending those questions if you have already done so. That being said, I'd like to get started with introductions. Rachel, would you mind telling us a little bit about your background and your current role at Mount Sinai?
Of course. Thanks, Gary. So I've been working in the healthcare industry in New York City for the last 14 years, since getting my MBA at Kellogg. I started at New York Presbyterian Hospital, where I did project management in the revenue cycle department. After that, I went to Remedy Partners, which is a health tech company in the value-based care space. I did account management there and then also spent some time on the clinical team. After that, I went to the payer space at Village Care Max, where I was VP of Quality Management and Performance Improvement. From there, I went back to the startup space at MD Calc, which is in the clinical decision support space. And finally, I've been at Mount Sinai for the last 3 years on the Consumer Digital Innovations team. This is an internal startup within the health system that was formed in 2018 to build custom patient engagement software. And the vision was that this would be one of the differentiators for Mount Sinai in the crowded hospital market that we have here in New York City. So I started as head of product operations, managing our implementations and customer relationships within the health system. And then I became head of the entire 30-person team, comprising engineering, operations, and product and design. Most recently, the health system has made a pivot in their strategy and decided to utilize vendor-provided solutions rather than an in-house custom platform. So I'm helping to manage the transition from that bespoke platform to that future state provided by vendor solutions.
Thank you so much, Rachel. Such a breadth of experience. And then I know, Joe, you're equally impressive. So can you give us a sense of your background and your role?
Sure. Thank you, Gary. Really excited to be here today and speaking about this really important topic. I have 7 years experience selling to health systems throughout the United States. Most recently, I served as Senior Director of Sales and Customer Service for a life sciences startup, and we were selling primarily to academic medical centers. Again, that was across the country as well. And I'm currently the founding customer service lead for another startup called Pharmacist Healthcare Dashboards, or PHD, and I'm serving as an advisor for Lighted, in addition to other duties as a sales and a strategist for early stage companies.
Thank you so much. Okay, so we can see this from both ends. You'd be hard pressed to find better set of people to talk about this with. And I'd actually like to start with health systems as a whole. So for the folks that don't or have yet to work in or with the health system, Rachel, would you mind sharing how these organizations function?
Absolutely. So at an 80,000 foot level, what are the key characteristics of a health system? First, they tend to be quite large organizations. So even a small single site health system, often around 10,000 employees, a Mount Sinai or a New York Presbyterian with several sites, 40 to 50,000 employees. And then you've got giants like Northwell Health with 80 plus thousand employees. So when you're dealing with an organization that big, there are a couple dynamics that are different from when you're in a smaller startup. One is that people don't all know each other, right? So as you're selling to a health system, you might have a customer who's in the department that's going to use your solution, but then you're also going to have to deal with procurement and legal, and the people who are going to use your solution may not even know or have relationships with the folks in the legal department or the procurement department. So you have to develop kind of different sets of relationships. The other implication at a smaller organization, there's generally a high level of alignment of goals across the different departments, right? Everyone is working toward the next launch or the next customer. At a very large organization, you end up with more narrow and differentiated goals of different departments. So within a health system, the goals of the neurosurgery department are going to be quite different than the goals of the procurement department. And so again, this makes it a little bit more difficult to get what you need from different departments in order to move forward with the sale. Second key characteristic of health systems, they're usually old organizations. So most of the health systems in New York City, for example, were founded in the late 1800s, compared to startups, which of course were founded, in the last few years or the last decade at most. Implications of this, the software that they're using is typically older versions of things. So at a startup, you're probably using Gmail for your email and you're probably using Slack for your communications. Health systems are not. They're on Outlook, maybe using Teams. And then the other implication of being an older organization is there's often a slightly more old-fashioned or conservative culture. So for example, health systems executives usually wear suits when they come into the office or go to meetings, which is not as standard in startups. Third characteristic, health systems are usually under pretty significant financial pressure. So typically a health system's margins are low single digits if they're positive at all, right? A lot of them are nonprofits. It's not a super profitable industry to be in. And so the implication of that is that they don't have piles of money sitting waiting to be spent. And so you really have to have a strong financial case for why bringing in your tool or solution is going to save money or improve revenue. Fourth item, health systems are highly regulated. And not only are there a lot of regulations that they have to abide by, it's one of the few industries I know where the people regulating them frequently show up in person unannounced to do audits, right? So as a Mount Sinai health system employee, and Gary, I'm sure you get the same, we get emails frequently saying, oh, Joint Commission is on site at Mount Sinai West today, or the Department of Health has showed up at this other Mount Sinai location. That breeds, understandably, a culture of risk aversion, right? You don't want to try something new that might break something if your auditors could show up tomorrow unannounced. And then related to that, health systems tend to be change averse, right? For the same reason that they're risk averse, they value consistency. And so those are some of the barriers from a cultural perspective that you'll have to overcome in order to get them to try something new.
Thank you. And I imagine as vendors come in to disrupt that consistency, that must interact with your role as well. So how do you interact with vendors in your current role?
Yeah, a couple ways. So first, I receive a tremendous amount of cold outreach from vendors who want to sell things to Mount Sinai. And this could be anything from an operating solution to a website marketing solution to real estate solutions. I probably get maybe 24 cold outreaches a week from vendors. Second, I've worked to bring some vendors onto Mount Sinai because the Consumer Digital Innovations team wanted to use some product or feature that they were offering. And then third, in the project that I'm currently helping to manage, where we're replacing a custom in-house built system with vendor provided solutions, I'm working closely with several of those vendors to get those solutions integrated and launched.
Okay, that all makes sense. And you mentioned it's close to 24 a week. So when these vendors reach out to you, do you tend to engage?
Usually no. It depends on a couple factors. So number one is what medium do they use to reach out to me? The vast majority are sending me emails to my work email. And right off the bat, when I get one of those, I'm kind of annoyed, right? Like I'm in my work email to do my job, not to interact with new vendors. I didn't give my work email to these people, right? So it's a little bit of an invasion that way. In contrast, I've noticed some vendors will reach out to me on LinkedIn And there I'm much more open to engaging because that's a platform where I go not to do my day-to-day job, but to network, to meet new people. And it's entirely appropriate and expected that someone I don't know might reach out to me there. So that's one of the variables. The second aspect is what is the content of the outreach? So most of them launched right into a sales pitch. Here's our solution. Do you have this problem that we can solve for you? And can I get a call set up? 90+% of the time, I don't have the problem that they are looking to solve, right? Again, it's operations rooms or it's a real estate solution or a website, right? It's not something that is in my wheelhouse. And so because they've framed the outreach as, do you have this problem? It's a no. And so why would I respond? In contrast, if they reach out and say, hey, we're working on this solution, we see you have background in XYZ, would you be willing to take a look and give us some feedback? Now that's more interesting, right? Now I'm feeling flattered, and they're asking for something that I can say yes to. It's framed instead of that they're going to help me, they're asking me to help them, and I'm more inclined to be responsive to that. And then I'd say the third element is whether I've interacted with this person before. So if it's someone who maybe I met at a conference or we were on a webinar together, or we've had any kind of interaction before, maybe they've interacted with my LinkedIn content, I'm more likely to respond in that case than if it's a complete stranger who I have zero history with.
A lot of that resonates with me. I mean, now we're actually getting into your role, Joe. So you're reaching out, and many of the people you end up first in contact with aren't the direct decision makers. So how do you actually nurture those into connections that are a bit more fruitful?
It's a great question. As Rachel mentioned, that these health systems, some of them are so large that you're really unlikely to reach the exact person or even the department that you're looking to connect with right off the bat. So I think it really helps to be open-minded and start having conversations with people at all levels within the health system. And kind of an interesting story, this is how I met Rachel. In fact, we connected on a Slack channel on Health Tech Nerds, and I was working for one of the startups I'm representing. And I mentioned that we have a demo. We'd love to connect with health systems anywhere in the US, but especially in New York. And she mentioned that, Rachel mentioned that she'll be leaving her role soon and that she's not necessarily the right department to speak to. But I mentioned that, I'm open to hearing your feedback and we'd like to connect with you and see what you think of the program. And she was able to give us not only this wonderful feedback that helped to improve platform that we've developed, but also to eventually make an intro, through her Mount Sinai email to one of the connections within the health system that I was the appropriate contact for us to speak to ultimately. So going kind of indirectly might be your best bet. I know it's counterintuitive, but the indirect approach may be the most effective in this case. And also this experience, reinforced the idea that every professional interaction you're having within a health system could be a potential gateway to valuable opportunities. So again, stay open-minded to those possibilities.
Thank you. I mean, thank you both for sharing a lot of your experience. Let's actually consolidate some of that now. So based off all of that experience, Rachel, what advice would you give companies that are looking to find a way into a health system?
Sure. I would echo Joe's comment about reaching out to a broad audience. I think it's actually not smart to try to go to the decision maker first. I think it's smarter to try to talk to some folks who are a little bit peripheral, more junior, gather some of that intel that's going to allow you to really tailor your pitch so that when you do get a conversation with the decision maker, it's really sharp and targeted. We talked about reaching out through different venues. I suggest reaching out through LinkedIn rather than email first. What I've noticed some vendors will do is send me simultaneous identical messages, both to my work email and to my LinkedIn, which really nullifies the advantage of using LinkedIn because now I'm like doubly annoyed. I'm feeling bombarded. So I would recommend try LinkedIn first. If you don't get a response in a few days, then feel free to go ahead and try the work email because you have nothing to lose at that point. But I would start through the avenue where maybe folks are going to be more likely to respond. Um, as I mentioned, I think you're more likely to get responses if you ask for input and feedback rather than assuming that the person you're contacting has personally the exact problem that you're looking to solve. Um, and then I would also suggest attending industry events to try to make some of those connections. There are a ton of webinars going on. I think especially after COVID, that's become more common. Most of them are free. If they're paid, then it's a pretty low barrier to entry. And I found that psychologically, people are more open to an outreach from someone who was on a webinar with them, even if you had no contact at all during the webinar. Just being able to reach out and say, hey, I saw you on the XYZ webinar, would love to set up an intro call. A lot of folks will be open to that. So those are some tips on getting that initial conversation. And then if you're able to get that call, I would advise folks to do some preparation up front, like know some basics about the health system, know what EHR they're using, know how big they are, how many patients they have, figure out if they've been in the news for anything recently. Like that's all good context to have. Um, because health systems are risk averse, you want to make sure you're providing evidence that your solution works. So ideally, a case study, at least one, maybe more than one, or a pilot can be very effective. Health systems don't tend to want to be the first. They're not looking to be a trailblazer. They want someone else to de-risk the solution first. And then based on the fact that they tend to be financially strained, you want to present a clear financial ROI. So by all means, talk about your impact on patient experience and staff experience and quality, but make sure you're also incorporating, and here's how that translates into cost savings and or revenue improvement.
Okay, that makes a lot of sense. And it's a lot of information to incorporate into whatever time frame you have. So Joe, actually, when you're doing that, when you're actually customizing your communications and your sales tactic, does some of this resonate with how you've been interacting with health systems?
Definitely. And that is one of the big challenges is compressing your message and presenting it efficiently so that you could have those discovery calls and introductory calls and really connect with your audience. So there's a few ways that I've really customized my communications over the years. So number one, and this is probably the most important, having a really solid slide deck, maybe 7 to 10 slides tops, and having an appendix at the end where you can kind of put things in there that may not always come up, or questions that rarely come up, or objections like that, but you're prepared for all those scenarios. And it shows that you've done your homework, and it enables you to really fluidly in the conversation answer any questions that come up. So the concrete data should be in there somewhere. A case study, as Rachel mentioned, that's essential because most health systems probably don't want to be the first one to take a chance, a leap of faith with your company. So it's really good to have demonstrated some experience that will resonate with them. And I think number two is, and this is really basic, but it's definitely worth mentioning, is making sure that you don't have any information in there. You waste any time going over information that's not relevant to your prospective customer. So you want to keep this really tight. And then number three would be leaving time for questions. So you're keeping it simple, leaving time for questions, and respecting the time limits. So these things kind of mesh together. So if you ask for a 20-minute call, don't go into 35, 45 minutes. Really respect your customer's time. And that shows you're keeping your word. So you're already building the relationship in a very subtle way there. And finally, I would mention that you really should be spending a lot of time talking to your customer about their problems, their current situation. How are they addressing? First of all, do they have a problem that you can address? What are they doing to address said problem? How is that strategy working? And this may save you time. Maybe it's not a good fit. Maybe it is a great fit. Maybe you need to go back and build a custom solution for this customer to solve the issue that they're working on. But really, your goal in that discovery call is to uncover those unmet needs and to build your relationship. So the first step, build that relationship. And then before you could even have a sales discussion, really, you have to have that trust. So these are all essential elements that I've worked with over the years.
Yes. I've never seen a business relationship without trust go well. Thank you. So let's assume we got the call. And let's assume it went well and we have a champion at an organization They'd love to sign a contract. I'm naive enough to think at times that that's the end of it. Cool, see you next week when we sign a contract. But Rachel, I know it's more than that. What does that process actually look like at a health system?
Sure. So at Mount Sinai, there is a application steering group committee. This is a group of, I think, about 20 or 30 folks from different departments across the health system. And anyone who wants to bring in a new piece of technology has to go to this group and get its approval. So there's a form that gets filled in with basics like what is the company and what's the problem they're solving and what's their solution and what's the cost and the terms, the length of the contract. So your champion would go to that meeting and present that they want to enter into a contract with the vendor. Importantly, the vendor is not at this meeting, right? So in order to give your champion the best chance of success, you want to make sure that they're adequately prepared. You want to anticipate objections and questions that might come up and make sure that you've prepped them for that. And that committee, they'll listen to the presentation. They might have questions, they might have concerns. And if the champion doesn't have the answers to those at that meeting, they're going to have to go back, talk to the vendor, gather more information, and then present again at the next committee, which might be a month later, right? So you're starting to see how this can take a long time. Second step, once that committee signs off, then the process moves over to the procurement team. Now, the procurement team works closely with two other departments. One is legal, which is responsible for the legal agreements between the entities, so the BAA and the Master Services Agreement, et cetera. And then the other one is the cybersecurity team. So they're going to have to review and vet and sign off on any IT vendor that's coming in. So advice here, remember how I talked about health systems are large and so different departments have different goals. The lawyer who is responsible for making sure that the health system is okay with the terms and signing off on the contract, they've got a whole stack of other contracts in their queue from a host of departments across the health system. So they don't particularly necessarily prioritize this one contract. So you want to make sure as the vendor that you make it easy for them to move that contract forward. So for example, if the health system has a standard template for their BAA and you as a vendor have your own standard template, I would advise you to use the health system's template, right? Because if you make them go through and redline yours, that contract might go to the bottom of the lawyer's pile. And then similarly, the cybersecurity folks typically have a standard questionnaire that they give to a vendor and ask them to fill out about how is your data stored and how is it protected. And they may have questions. So both of these can take, several rounds of back and forth. Ultimately, if both of those departments sign off, the procurement team signs off, and then the contract goes into the signature portal. Now, depending on the dollar amount of the contract, if it's a low dollar amount, your champion, who's maybe the head of a particular department, they may be able to sign off and approve it themselves. But if it's a high dollar amount, it may have to be signed off and approved by their boss or their boss. And so now you have a situation where, oh, one person is on PTO for a week, right? And everything is just going to wait until that person gets back. So given all of these different stages and hurdles, closing a deal with a health system, it's going to take months, if not years. It's a lengthy process to get through.
Yeah, I'm on month 7 of at least one vendor conversation I'm in. But how about it on your side, Joe? Is that consistent with your experience?
Yeah, Gary, this definitely echoes my experiences. I know contracts can take years sometimes, and maybe that's a long example. But in my experience, the one of the best partnerships that I've built over the years took about 3 years from start to finish. And the contracting process, once we got to that point, to the end, was relatively fast, but getting there took a really long time. And the company I work for started as a secondary vendor with this particular health system, and we identified problems that they had with their primary vendor. And eventually, after really staying on top of having regular business reviews for the business the services we were offering the customer, and answering any questions that they had in a very prompt way, and really going above and beyond, we were able to get into that process. But first, we had to address the challenges that they identified with our first bid, and really fix everything before we went back and were able to ultimately put in a successful bid to earn their business. And so that's really, that's probably an extreme example of a long sales cycle, but you definitely have to be prepared for that. And just to go back to the contracting piece, you do want to make it easy to do business with your company, especially if you're early stage, right? And you're looking to get your first few customers. You don't want to be throwing up any additional hurdles that you don't need to. So in terms of the contracting process, imagine that your customer, the health system, has a big stack of contracts that they have to work through before they get to yours. So any back and forth could really cause delays that you really don't want. And one thing about being easy to work with is sometimes you may have to accept terms that are not necessarily ideal for your company or your startup. But I think an important thing to remember is that at the end of your first term with your new partner, you may have an opportunity to renegotiate those terms and secure a better deal for your company. Also, there's a lot of benefits for early stage companies because you're gaining momentum. If your customer lets you use their logo or their name in your promotions, saying that they're a customer, that will lend you kind of some social proof that you could leverage to go out and present to others that may find you more compelling at that point. And then it also, it's giving your company runway, which is something that a lot of the early stage companies that we've talked to have an interest in. So of course, these are all benefits of kind of being flexible in that scheduling process.
Thank you, thank you. Now, being in the health system, I have no say in how long this takes as much, but if I'm a vendor, I look at this process and I'm thinking, okay, that's a lot of investment to get into a health system. So if I get it, I want to make sure that relationship lasts. Before hopping into my next question, just wanted to acknowledge, I see your questions coming in. Feel free to keep bringing in those questions. At the end, we'll go through all of our Q&A questions. Thank you. So, with my priority of maintaining a relationship now, what tips would you offer, Rachel, on keeping health system business?
Sure. I mean, I don't think the tips here are really specific to health systems. I think it's really just general client service. So making sure that you're responsive to requests and emails, right? Don't sit on something for a week before getting back to your customer. Proactively communicating if there's an issue, if there's an update. Something I've seen that's been a pain point is sometimes vendors will wait until, your weekly check-in call to share that they've run into a blocker. Don't do that, right? Reach out proactively when you have an issue. And then communicating ahead of time if there's going to be, some key team member has PTO. If you've got team members who are in other time zones or other countries, making sure that the client knows about their availability and changes there. And then I think what we spoke about with regard to flexibility and deferring to the health system standard processes, that applies to that ongoing relationship as well. So if you're at a startup, maybe you use Slack, the hospital uses Teams. Don't try to get them to use Slack with you. Like, you need to adjust and use Teams. And that may not be your preference, but that's going to be the best way to reduce friction with the client and ensure that you're having ongoing and smooth communications.
Makes sense. I mean, I actually would love to hear you weigh in this as well, Joe.
Sure. I really like Rachel's point about responding promptly to your customers' requests. And this is something that one of the organizations I work for really trained us as a sales team to be incredibly responsive to the customer. So we were expected to pretty much all situations have a response within 24 hours to any inquiries, especially if they're not emergency, of course, like these, kind of run-of-the-mill customer service things. But we still had to get a response. And if we didn't know the answer, or maybe it was something that needed to be escalated to a medical director to have a conversation, we would say, hey, you know what? I'm going to look into this and have the appropriate subject matter expert reach out to you to make sure that this issue is resolved. Or if it's something more challenging, we'd say, hey, oh, that's a great question. We don't necessarily know the answer to that yet, but we're going to look into it. We'll get back to you in 2 weeks. So you're kind of setting those expectations. And I think the customer will remember this. And again, this goes beyond, health systems. I think this is just good practice for customer service overall. But I think they'll remember that when they go to renewal. It's like, oh, wow, this company is really easy to do business with. Whenever we have a problem, we bring it to their attention. It solve right away, and it's prompt and professional. So that really goes a long way in building those relationships.
That's great. No, honestly, I mean, a few moments ago, I asked you both to consolidate your learnings, and you've done great to make this really tangible for our viewers. Um, I'd like to hear some examples now. I mean, Rachel, do you have any stories of companies or individuals? I mean, for every good story, I know there's a couple bad ones. So, do you have any anecdotes of maybe things we should avoid, mistakes that were made?
Yeah, there was a business development rep who reached out to me wanting to pitch a product to Mount Sinai, and I responded that I was happy to meet with her and listen and give feedback, but wanted to be upfront that I wasn't a decision maker in that space, and I'd also be leaving the health system soon. And so she initially said, "Okay, never mind," and then came back 2 days later and asked if I could refer her to someone else. Now, if she had taken my initial offer to have a conversation and I had heard her pitch, then maybe I'd be willing to make a referral, but I'm not going to do that when I haven't even spoken to this person. So I think that was a lost opportunity. I had another situation with a vendor that my team was trying to bring in. We wanted to outsource some software development, and the contracting process was just hurdle after hurdle. So it felt like almost every one of Mount Sinai's standard terms in terms of the payment terms and different elements in the contract, the vendor had a different standard and they wanted to kind of go back and forth and debate these things. This created a lot of friction with the legal team as well as the procurement team. At one point, we were looking to put a BAA in place, and the vendor suggested that instead of the BAA being between Mount Sinai and the vendor, that we have individual BAAs with each of the individual contractors. And when our lawyer and the procurement folks heard of this, it really diminished the vendor's credibility in their eyes because it was a very bizarre suggestion and it would have been a lot of extra work on our side. And we said no to that, and the vendor was like, okay, fine, never mind. And then the straw that broke the camel's back was a difference in the insurance amounts that Mount Sinai standardly required versus what the vendor had. And I think the vendor would have been willing to adjust their insurance amount, but because we had already hit so many points of friction up until that point, when we got to that mismatch, the lawyer and the procurement person just said, you know what, we're done. Like, you need to find a different vendor. We're not moving forward with this. So that was, a lesson about trying to be flexible as a vendor and be easy to contract with. I also had a couple times where I agreed to go on a pitch call and was kind of underwhelmed. One of them, I got on the call and the person giving the pitch didn't have a deck, didn't have a demo, was just sort of talking to me in generalities, which I don't know, maybe that works for some people, but for me, it's not going to be sticky if I don't have a visual to look at. And then during the presentation, he asked me what EHR Mount Sinai used, right? Which means he hadn't done even 30 seconds of research before the call. And then I had another call with a team that was looking to address a particular illness area, and they talked about how this area of illness costs the healthcare system X billion of dollars a year. And so that's why it was financially advantageous to address it. But what they didn't seem to grasp is that a portion of that cost is revenue to health systems, right? So you need to understand the underlying economics of how a health system works in order to make an appropriate pitch in terms of the financial value of your solution.
I'm actually very glad you brought that up because one of our Q&A questions touches on that a little bit. So we'll dive a little deeper there.
Great.
But after hearing some of those painful topics, I can imagine going through the month-long vendor process just to have it end later. How about the flip side? How about the actual good examples of companies you've worked with that did things fairly well?
Yeah, so I had one business development rep who saw a LinkedIn post that I put up that included some tips on selling to health systems. And, I don't know if he had found me and was following me. I don't know how exactly this came into his feed, but he liked the post and he commented on it. And then he reached out to me to thank me for the valuable tips in the post, and we had a little back and forth. And then he asked if I would be willing to have a meeting and learn about what his company offers. So that was very smart, right? Because he's engaging with my content and building that relationship and that rapport first before asking me for something. Second example, kind of in a similar vein, I had a company reach out to me to say that they were organizing a webinar on digital front doors of health systems, and they wanted to know if I would be a panelist in their webinar. So again, they're not pitching something to me right out of the gate, but they're actually offering me something that's valuable. And so, part of the common thread here is building a relationship first. And what both of these people actually did, which I think is very astute, is they found a way to flatter me, right? Which kind of it butters me up. It makes me feel more positively toward them. So then when they ask for my help, I'm much more likely to be willing to give them my time.
Yes, no, thank you for being so honest with how this all works. I mean, in order to be able to flatter someone, you have to understand what they care about. And in this case, with health systems, it's staying up to date with different trends and developments happening because it affects their daily lives. So honestly, Joe, if you're trying to build these relationships, how do you personally just stay up to date with all the same information and adjust your sales approach accordingly?
Sure. I spend a lot of time looking for articles, podcasts, webinars, things like that that are specific to the fields that I'm working in or the disciplines that I'm working in, and really absorbing that information and learning about what's new, what's cutting edge. And the great thing about that is that gives you an opportunity to have valuable touch points with your customers or your prospective customers. So just as a habit, what I've been doing is sending out once a month check-in emails. Oh, here's an article that I came across that may be interesting, especially if it references something that came up maybe in one of our previous meetings. Oh, we talked about this topic. I thought you might be interested in this podcast or this article. And I think that goes a long way. And it also creates an opportunity to have conversations with your customer that you may not have had otherwise. And so I would definitely suggest that to our listeners today if you're looking to build your relationships.
Thank you so much. I might actually ask you to curate my email list later. But just like with Rachel, I'd love to hear a great story from you as well. So I'd imagine with all of the contracts you've been able to close, there had to be a challenging one that is near and dear to your heart because you were able to overcome it. Would you mind sharing that example of a challenging contract and how you successfully closed the deal?
Sure, I'd be happy to. So early on in one of my roles, I had a chance to look at hospitals or health systems that were outside of my company's immediate service area. I just started making a few phone calls to them, like quick introductory calls to see if there are any challenges, if there are any uh, problems they have with their existing vendors. And, I quickly discovered that a lot of them did. And, initially, not many of them wanted to meet with me, but I found one that was about 4 or 5 hours away and that was willing to meet with me. And I really jumped at that opportunity. I said, great, let's schedule a meeting for next week. And I went up there and I met with them. And sure enough, they did have some challenges with their existing vendor providers that I thought, my company would have been able to resolve. And so they ended up signing with us initially for a 6-month deal to work with us. But the challenge there, I think what made it challenging was even though we had the right service and we identified the problem that we could solve, there was some skepticism there because they had never worked with us before and they were used to working with a local company that they had a lot of experience with. So even though that wasn't ideal, there was some hesitation there. And I think offering them that initial term, like, hey, why don't you try us out for 6 months, work with us, see how it goes. And if you're not satisfied for whatever reason, obviously, they could walk away at that point. But we made it easy to have that conversation and to do business with us. And ultimately, that allowed us to get a foot in the door with other hospitals that were nearby. Like pretty soon, word of mouth started to kick in, and we had that social proof, that, oh, now all of a sudden we're getting inbound calls from their neighboring facilities. So I think that was a really good example of a time where I kind of pushed the limits of what I could do and what other sales reps could do by having those initial conversations and being easy to work with and looking beyond what's right in front of you.
Thank you. I mean, listening to you, I almost feel the need to congratulate you, but I'm probably a few years too late. So I'm glad that that's how we're going to end this section of questioning. Next, we're going to go into some of the email submitted questions. So last chance if to throw in some Q&A questions in the Zoom. As soon as I'm done with these 3 email questions, I'll hop over into our Q&A in the Zoom chat. So our first question here goes to both of you. It's around health system consolidation, and I'll just read it. Given consolidation among smaller systems, do you think startups selling into distressed systems or middle market systems who hypothetically have the most to gain from technologies that extend their services or drives or save revenue will die out? And I guess let's start with you, Rachel.
No, I wouldn't share that prediction. I think that smaller health systems can be a great target, especially earlier on. It's less bureaucratic. There are fewer hurdles to get into a system with just one site rather than multiple sites. And smaller organizations are just, it's less bureaucracy and more relationships that are there already. I'd also say if you are targeting distressed systems, they may have more incentive, right, to use a new solution, especially if it's aiming at some of their key pain points versus, a Mayo Clinic or a Cleveland Clinic that's quite solid, right? Maybe they have less urgency around trying something new. And then finally, if you get into a smaller or a distressed system that's later acquired by a larger health system, that might give you a foot in the door to be implemented more broadly. I would also just say that there's never any guarantees, right? You could absolutely sell into a health system that goes belly up, and then that might be a dead end, but there could be an upside as well. So it's hard to predict.
Okay, that makes a lot of sense. I mean, is there another perspective you'd like to provide, Joe?
I think I would just add on to that. You never know. There is no guarantee, but working with a even an individual hospital or a smaller system, if the consolidation does happen at some point in the future, as Rachel was suggesting, that could lead to an opportunity to present to the larger system that you may not have had before. So I wouldn't necessarily close myself off to those possibilities. And generally speaking, things can move faster with the smaller customers or the smaller hospitals, and they may be more open to trying pilots or new projects that haven't been done before. So there's a lot of upside there that I think is worth exploring.
Thank you. It correlates well with some of what you mentioned around casting a broad net at the earlier part of the talk. So our next question is aimed directly at you, Rachel, and it's from a health system employee. So how do you align on health or business goals before you look for vendor solutions? And second part of the question, what are your evaluation criteria, categories for an external vendor you are considering?
Sure. So in terms of goals, I mean, health systems, like any large organization, typically have goal setting processes that are often top down. So, as the head of consumer digital innovations, we had goals around supporting new implementations. We had goals around making sure that the number of issues or bugs that came up was low. There were times where we were looking at certain types of expansions, like we were integrated with Mount Sinai's version of Epic, but we were considering maybe we want to have a goal to be able to integrate with other versions of Epic, maybe even with Cerner. And so, with some of those goals, we felt like we'd be able to achieve them with the internal resources we had and the technology that we had. But for example, if we had moved forward with integrating with Cerner, that would have required a lot more engineering resources than we had on the team. And it's quite difficult to get approval to hire new FTEs. So that would have been an area where it may have made sense to bring in some contract engineers. And then in terms of comparing different vendor solutions and selecting the one to move forward with, a lot of different criteria. One is integration with our existing processes and tech stack, right? Like typically health systems, if you're looking for an IT solution, you want it to integrate with your EHR and potentially with other areas. You'd look at the different features and functionalities, compare those across the board and see which vendor's offerings line up best with your needs. Health systems are going to typically look for something that's established. So we want evidence, we want proof, right, that this has worked in similar organizations in the past. We may want to talk to references at other organizations to hear about their experience. And then it's not just about the tech functionality, but it's also about the service. So I'd want to know about what SLAs does a vendor have in place in terms of resolving issues. I want to know about who's my account manager, right? Who can I reach out to if I have an issue? And are they going to be available and responsive to me? And then price, of course, plays a role as well, right? That's the most objective and easy to compare, but it's definitely not the only one.
Thank you. And just a lovely balance from email. This one's directed at you, Joe. Okay. It's a sales question about reaching out to CFOs. And as I'm reading it now, it sounds like we touched on this before. Any suggestions on targeting health systems CFOs, though outreach outside of warm, or sorry, through outreach outside of warm intros and referrals?
It's a good question. And you're right, Gary. We kind of touched on this a little bit in the beginning, starting with the more junior employees within the system and kind of working your way up before you go to the C-suite necessarily. I think one place to start, and maybe in this particular case, is with the users. So if you could identify some of the users of the program within the hospital, find them first and like try to do some demos with them and see how that goes, see what kind of questions come up, and then go from there. And if you work that patiently, I think you'll find the route that you need to go.
Okay. Yeah, no, that makes a lot of sense. All the email questions are set. I'm looking at the Zoom questions now. We have 4 thus far. Feel free to keep submitting and I'll go until we have about 5 minutes left in our webinar before closing out. So the next one I alluded to earlier as it came in. I'll just read it verbatim. Legacy fee-for-service healthcare is a bit unique because financial upside, such as revenue, is synonymous with more sick patients. Putting the broader conversation about the good, bad future to the side, how do we talk about the value props of a solution with health systems? Saving costs isn't usually as sexy or exciting as more top-line revenue, and clinical outcomes tends to be a bit squishy. So what should we highlight? And I guess let's start with you, Rachel, since it's geared towards the health system.
Yes. So I'd say first, I agree that more sick patients is one way of fueling more revenue, but there are other ways as well, right? So you can talk about market share, you can talk about attracting and retaining patients who might otherwise go to a competitor. You can talk about increasing access, right? So maybe there are existing sick patients who aren't getting access to care, right? If you can then deliver care to them, then you make more revenue under fee for service. You can talk about increasing adherence, right? So there may be patients who are prescribed a course of treatment and they only come in for 2 of their 10 visits, right? If you can get them to all 10, then that's more revenue under fee for service without increasing the amount of sickness in the system. And then I would also disagree with the presumption that cost savings is not as attractive. You know, maybe it's less sexy from some people's perspectives, but I think that's very compelling from a health system perspective. I would frequently hear Mount Sinai's CIO say that, you know, we've been asked as an IT department to slash X% off our budget. So at that point, a vendor who comes in and says, we can cut your costs in this area, that's going to be very compelling. And I would also say that cost cutting value propositions, I think, are more concrete, are easier to prove because we know the current cost, right? And we know the cost of the new solution. And so to have, you know, a calculator that says, here's what you're going to spend on the solution and here's what you're going to save, that feels more believable than a promise that we're going to increase your revenue, you know, you're going to attract more patients, they're going to stay longer. Even if you've implemented in another system, the patients there are different, right? So something that depends on patient behavior feels a little less concrete, and I'm going to be less confident in that value system then saying, what are you spending on this now? We can provide a better service that meets the same needs for less money.
That makes a lot of sense. I mean, Joe, do you have any ways that you can validate some of those propositions?
Yeah, in my experience, the pretty much everything Rachel said rings true, and I think I wouldn't overlook the value of the cost savings if you can offer a compelling, program that could save the hospital in their current costs, and you could demonstrate this clearly. I think that is very attractive, especially if you're increasing efficiencies and overall improving their workflow. So there's a lot to be said about that.
Okay, thank you. And thank you, Albert, for submitting this question. The next few are from Anonymous. So let's get through them. The next one is, what is considered a low versus high dollar amount for a contract? I imagine there's variables here, but I'll pass this over to you, Rachel.
I don't have a high level of confidence of the specific dollar amounts, but I want to say maybe below 10,000 is probably easier for someone lower down to approve. It goes up to 100,000, that's another gate, and then it might be 500,000, something in those ballparks. But I would have to check on the specific lines.
Appreciate your insight. I guess, Joe, any insight on your end for this one?
That sounds familiar. I think anything probably over 500,000 would require a little bit more legwork to get approval on than something that's on the smaller end for sure. And that, generally speaking, takes longer.
Okay, thank you very much. Next up, is there a best practice for how a vendor can properly point out or showcase that their solution is better than the health system's existing solution? We touched on this a little bit now that I'm reading it. I imagine there might be times where a vendor's pitch comes across as unbelievable, arrogant, or maybe even rude when they propose they have the best solution. So again, I'll start with you, Joe, for this one, since it's about approach.
Sure. Yeah. So the approach is key, right? So if you start off with automatically knowing that you have the better approach for this customer, that's a pretty big assumption, I think, to lead with. So I really think, again, you're going to want to listen probably a little bit more than you're speaking in these meetings with the customer. And having those introductory calls are going to allow you to discover that, okay, what are they actually doing? And so then you have to know, okay, how does what we offer compare to this? And you need to know these things before I think you could confidently assert that you have a better program or platform or service to offer the health system.
Okay, that makes sense. And Rachel, anything to validate there?
Yeah, I would say that the establishment that there's a pain point in the status quo has to come from the customer, right? If they don't think that there's anything wrong with their current solution, you're going to have an uphill battle, and that's not a place to focus. And then in terms of having credibility in claiming that your solution is better, that's where the case studies come in, that's where the references come in, that's where the quotes come in. Because, right, you don't want them to have to take your word for it. You've got a vested interest in saying your solution is best, but offering for them to, look at some of the detail of how someone else has benefited from implementing your solution or talk to them, that brings credibility.
Hey, with our next question, it's looking like we want a little more detail around something we talked about earlier when implementing a solution. So after all the agreements are signed, what are some best practices for the implementation process and change management? And this attendee specifically cares about small health systems with limited resources. So I'm going to ask you, Rachel, as you're more on that side of it.
Sure. I would say it behooves you as the vendor to provide a lot of the legwork, the manpower and the guidance on what the implementation should look like. You don't want to expect the health system, especially a small one, to bring in like a change management team or a project management office to guide this. You want to be really taking the lead here. So a couple elements of implementation. One would be testing. You want to make sure you're doing thorough testing with your customer, letting them make suggestions for different scenarios, and having that be done really exhaustively before something goes live. Training is also really important, right? So this is going to be training end users on how to use the system, as well as training them on how you want them to reach out if they have questions or if something breaks. Um, and then it can also be effective to do a phased go live. So depending on the solution, right? There are some instances, like if a health system is switching to a new EHR, you may have to do it all at once. But if you have the option to initially go live in a smaller environment and kind of get out any kinks there before a broader rollout, that can also be a good technique. And then finally, for like the day of go live, it's often good to have folks from your team either on call or even on site, right, at the site of the hospital to provide that extra sense of support, so that the folks who are implementing can easily reach out and get help if they have questions.
Thank you so much. To be able to get to all of the questions, is there any quick notes you'd have to add here, Joe?
Oh, no, I think we can move right along because I see there's a few more left.
Yeah, I'm actually excited. I think we can get to all of them. So we're going to answer these last two and then close out this day. So to understand the financial ROI of your solution, you need to rely on the health system you're working with to get that information. How do you tactically think through the right information to ask for, to validate, and what cadence to ask for it, et cetera, for your first case study? So I'll pass this over to you, Joe.
Sure, that can be sensitive data that the hospital would have to share with you. So I think that would come very, later in the conversation when you've established that rapport and there's the trust there. But figure out really, you don't want to have a lot of back and forth. So we're back to this, really know what you're looking for and make it easy for the hospital to give you that information. And so you want to operationalize this, make a list and share it with them, and kind of go from there. But I think you really have to think through exactly what you need for that case study and think about the things that could go wrong. Like what could go wrong with this process? What is there anything we don't know yet that we need to ask about? So these are all key questions. If you're doing this for the first time, it can be tricky. So make notes as you go for the second go around.
Okay, thank you very much. And any quick notes, Rachel, before we hit the last question?
That's fine.
Okay, so the last one is, have you had any experience with value-based contracting, upside and or downside risk sharing? Do health systems have an appetite for these contracts? And I guess for you, Rachel, I'll pass it to you first.
I don't have experience with that from the health system side. When I worked at Remedy Partners, we were serving health systems that were voluntarily participating in bundled payment programs. So that was value based. And I actually talked to a startup today, that works, they have a product that helps predict the likelihood that a surgical site will get infected through pictures. And they specifically mentioned that they're selling this to health systems that are being reimbursed through value-based models where they have an incentive to prevent that infection, because if the person gets infected and has to come back for a new surgery and readmission, it wipes out all of their profits. So, it's still not the dominant reimbursement model, but there is, some substantial investment in that from health systems.
Thank you. And any insight from you, Joe?
No, I think that covered it.
Okay, then we've hit all our questions. As we close out for today, Rachel, do you have any last words of advice for this group?
We've talked a lot about how hard it is to get into a health system and the barriers and just how challenging that can be. I would say that if you're able to ride that out and get a contract with a health system, it's really yours to lose. Because it's so difficult to get in, once there's an incumbent who's contracted with the health system, it's so much easier for your customers to keep renewing that contract than to bring in someone else. And for that reason, once you're in, even in one part of the health system, if someone in another part needs a similar solution, you may well just be the default, right? And they may say, oh, you know what, we're already contracted with this vendor. Let's just use them and not go through an RFP process. So those are some of the reasons that it can be really financially rewarding to go through those hurdles.
It's great to hear. And on your side, Joe, any
I
last words?
agree. It's definitely worth the effort to pursue these agreements and these partnerships over time. And as Rachel mentioned, once you're the incumbent, it becomes pretty hard to dislodge you, to move you out of that position. So it's worth all this effort. We don't want to make it seem too daunting, but it is, it is a process, and you definitely need to be patient. And one of the key pieces of advice that I would offer is that to ask your customers, your satisfied customers, for referrals, and to sing your praises and tell everyone all the great things that you've done for them and how you've solved their problems. And that will open a lot of doors to you.
Great. Early on, we talked about respecting time, and we are on the 1.5 hour mark. Thank you all for joining us. And thank you both for sharing your honest insight. We'll send the recording of this webinar out next week. Enjoy the rest of your evening, everyone.